I can assure you, you did not kill your loved one. For those of you who don't know me, my name is Andrew. I'm an ICU nurse. I've worked in hospitals for over 20 years and I know a few things. My hope with this video is that it will alleviate some of the survivor's guilt people have after putting a loved one on hospice. If you or a loved one have a terminal illness and have decided to no longer pursue life-sustaining care, dying in the medical field can occur in one of two settings: hospice, also known as comfort care, or euthanasia, also known as assisted suicide. Let's differentiate between the two because they're very different. In hospice care, death is usually imminent: weeks, days, hours. Death under hospice occurs because you are succumbing to your illness, oftentimes because we have stopped medical therapy, chemotherapy, dialysis, ventilator, medications. Medicine is given at a non-lethal dose in order to make the experience as pain-free and anxiety-free as possible. To reiterate, the medicine given during hospice does not end your life. The dying process occurs because of the disease. In euthanasia or assisted suicide, patients also usually have a terminal diagnosis. However, they may have more time, months, even years to live. Usually patients who pursue assisted suicide have begun to feel the symptoms of their disease, but would like to end their life early so that the disease process does not catch up to them. In euthanasia, medications are given at lethal doses. Assisted suicide is only legal in 9 states. Now we need to have 2 reality checks, and these are very, very important. Number 1, many people who are against hospice mistakenly believe that it is assisted suicide. They erroneously believe that someone is being put to sleep with medicine and killed. This is simply not true. Hospice is designed to make an already dying person more comfortable. If you are a person who is against hospice because you have confused the two, you need to please re-educate yourself. And if you have made someone feel guilty for employing the use of hospice on a loved one, you may need to apologize to them. You may have caused a very tragic situation to become worse by judging them for using hospice. Number 2, many people who have put a loved one on hospice also confuse the two and feel immense guilt afterward. If you have put a loved one on hospice, and I need you to hear me on this, you did not kill your loved one. You have shown incredible compassion and love by allowing that person to die in peace and comfort. Please put a peace on your heart knowing that you did something loving. If you were suffering and dying, you would want someone to do the same for you. You're okay, babe. You did something good. If this is hitting a chord with you, I'm talking directly to you. No more guilt. I love you.